Hi friends, this is Dr Kashish Kalra, consultant dermatologist, aesthetic surgeon and hair transplant surgeon from South Delhi. Well, we all know we are passing through this gloomy phase during this lockdown period, but I always believe there is always a second aspect to it. This is the best time to harness your skills, your passion, your hobbies and to spend lovely time with your family. One more aspect is you can give quality time for pampering your skin and your hair. So one of the most common queries during this lockdown phase which I am being asked by my patients, my friends and even my relatives is excessive dryness of the hands. See, we all are washing our hands almost 10 to 12 times a day, which is a very good thing to keep this virus away. But definitely we are compromising the health of our skin. So the best thing is to use a syndet based soap and keep a moisturizer which contains shea butter, liquid paraffin, glycerine or petroleum jelly just beside your washroom. As soon as you wash your hands, when the hand is a little wet and you dab it with a towel, put the layer of moisturizer and massage it vigorously. For the facial skin, I suggest a daily regime of CMS, which is cleansing, moisturizing and sun protection. Now, which cleanser has to be used depends on the type of the skin. So if you have an oily skin, you use a salicylic acid based or a glycolic acid based gel based or foaming face wash. If you have a dry skin or a sensitive skin, it's better to use a cleansing lotion which contains cetyl alcohol or stearyl alcohol. And immediately after washing, you have to put the moisturizer. And the best time to put a moisturizer is on a slightly damp and moist skin, so that the moisture retains for longer time. And third most important aspect which a lot of people are asking me that during this time of lockdown should we use a sunscreen? Well, my answer is definitely yes, you should use a sunscreen because these rays are there inside the house as well, and some of us are definitely enjoying our terraces, our balconies, so you have to put a sunscreen as well. Second important aspect is your diet. So try to have frequent meals consisting more of vegetables and fruits, mainly citrus fruits, and try to have more water. Drink more water as much as you can. Keep yourself hydrated. The good thing about fruits is you have to consume it, and the peel you can put it on the face as well, which helps to detan your face and it helps to clear the pores also and dead cell also. It works as a good exfoliator. One more exfoliator which you can make yourself at home is using some oats and honey, and just apply it at night, leave it for 15-20 minutes and then you wash it away. But one caution, whenever you are using a home remedy, it's not that everything which is natural is harmless. You need to be careful that it doesn't irritate your skin, it's not causing itching on the skin or redness. So before using it, what you can do is you put a small patch test, just do a small patch test behind your ear or at the nape of the neck, and just observe it for a couple of days if there is any itching or redness, and if you feel it's safe, then only you use on the skin. And when you're using these things, don't go out in the sun immediately after using it. One more aspect from dermatology point of view is your hair health. So I'll give you certain tips regarding hair as well. Before washing, put a little bit of oil mainly on the strands, but if you have very oily hair or an oily scalp, you can skip this step. And when you're washing, how to choose your shampoo? If you have a dry scalp and if you have an itchy scalp, it's better you use a sulfate free or paraben free shampoo which is pH balanced. But if you have an oily scalp with dandruff and sebaria, it's better to use a ketoconazole and salicylic acid based shampoo. And when you shampoo it, after the shampoo, just try to avoid wet combing and also blow drying, because both these procedures, if you are wet combing or you are blow drying, it leads to a lot of physical damage to the hair, and which can lead to more hair fall. Many times patient asks me, sir, I'm losing a lot of hair, so what should I do? See, one thing is important. What is losing too much hair? 50 to 100 hair a day is a normal hair fall. But if you are observing it is too much, it's better to consult a dermatologist. And there are various reasons attached to it. It could be nutritional, it could be vitamin deficiencies like B12 and D3 or serum ferritin. It could be cosmetic. Right now we are seeing a lot of patients coming with hair fall post rebonding, straightening, dyeing, color, and so on. So it's better if you avoid these things, though these look very tempting and are more or less necessary evils nowadays, but it's better if you avoid it. Third thing is stress. Stress could be mental, physical, or biological. So if you are, if there is any hormonal issue, you are missing your cycles, or if you were running a very high grade fever, or if you were hospitalized for some operation or reason, so that can hamper your hair health as well. So if you have too much hair fall, definitely seeking a doctor's review is very important. Nowadays we have a lot of procedures for hair growth consisting of some natural things like PRP, GFC. So here's wishing you a glowing skin and healthy hair. Have a safe lockdown, stay at home, don't go out, and please like and share and subscribe to this video. Thanks a lot.